Good afternoon, everybody, and welcome to the July Life Unites Us webinar, Uniting Provider Communities, Improving Access to Behavioral Health and Substance Use Disorder Services for Older Pennsylvanians. My name is Erica Saylor, and I'm a research associate at the Douglas W. Pollock Center for Addiction Outreach and Research at Penn State Harrisburg, and I'm going to be moderating today's webinar. For today, we'll be covering some quick items related to using Zoom, the Life Unites Us campaign information for any folks who are joining one of our webinars today for the first time. And then I'm going to introduce our speakers and they will give their presentation. And after that, we will have time for questions and wrap up for the day. Before I go over this information, I would love to have everybody pop their information in the chat, your name and organization, so that we know who's with us today. If you have any questions for our presenters at any point during today's presentation, please enter those into the Q&A feature and not the chat. It's just a little bit easier for us to comb down through them to make sure we can get your questions answered. If for any reason today you get disconnected from Zoom, please retry the original link. If for some reason you can't connect back in, just remember that this webinar is being recorded and the recording and slides will be posted on the Life Unites Us data dashboard after the webinar. Moving on to a little bit of information about Life Unites Us. Life Unites Us is a project developed to reduce stigma around substance use disorder. This is done by using a people-forward approach that aims to connect individuals through stories. Through research and practice and anti-stigma work, we have found that connecting people through their stories and similarities can and will reduce stigma. In order to do this, the team records stories of community members across Pennsylvania, stories of both personal recovery and as an ally to someone in recovery. These short stories are then produced and featured on the Life Unites Us website and social media. The intent is that by sharing stories of hope and resiliency, we can prove that recovery is probable, reducing stigma makes recovery more likely, addiction is treatable, those living with an addiction are just like everyone else, and those living with substance use disorder are so much more than their disease. As I mentioned in the last slide, this campaign can be found online. The website features a library of resources that are shared across social media platforms, and the campaign also works alongside a variety of local partners to bring it to life. The aim is to provide a platform for voices from your community and a resource to add to the work that many of you are already doing to end stigma. The great news is that you can join the campaign and help us end stigma by following and sharing. If you're a part of a larger organization or effort, we would love to invite you to become a partner with Life Unites Us. Partners of the campaign have the opportunity to help recruit and share stories from your respective communities. And as a partner, you can have your logo added to our website, receive curated campaign videos tailored to your community, be invited and get first access to our webinars and trainings, get access to exclusive partner resources, and also have input on what kind of trainings and offerings that the campaign provides. If you're interested in becoming a partner, you can complete the form on our partner page, or you can email Ashley, whose contact information is on the screen there, or just the general info at lifeunitesus.com as well. And without further ado, I have the great pleasure of introducing our speakers today, Stephanie Cole and Lynn Cooper. Stephanie is the Executive Director of the Pennsylvania Council on Aging and Director of Special Projects at the Pennsylvania Department of Aging. Having spent the first part of her career in leadership positions in private sector corporations, Stephanie opted for a mid-career shift to the field of aging at the PA Department of Aging, where she has held roles in quality assurance, supervised the department's data collection efforts, and most recently served as special assistant to the secretary. Some of her major accomplishments have included championing the department's 4-year federally required state plan on aging, leading the department's outreach and inclusion efforts with LGBTQ older adult communities, and developing collaborations with universities across Pennsylvania that have initiated ongoing intergenerational service learning programs, partnering students with older adults for semester-long virtual engagements that address educational goals of faculty and bring purpose to the lives of older participants. In 2022, these efforts earned Stephanie the Governor's Award for Excellence. Stephanie has a bachelor's degree in psychology from Shippensburg University and a master's degree in community psychology and social change from Penn State University. We also have Lynn Cooper with us today. Lynn is the Behavioral Health Policy Specialist at the Pennsylvania Association of Area Agencies on Aging. Ms. Cooper has had over 25 years of experience working on regulatory and policy issues for mental health and substance use disorder treatment providers in Pennsylvania. She is now working with the Area Agencies on Aging to help improve access to mental health and substance use disorder services in the Commonwealth. Ms. Cooper also has 6 years of lived experience helping her mother deal with mental health and substance use disorders in the last years of her life. Stephanie and Lynn, the floor is yours.
Great. Well, thank you so much, Erica. First, let me say, I'd like to thank, on behalf of my colleague Lynn and I'm Stephanie, and I'd like to thank you, Erica Saylor, and the Douglas W. Pollock Center at Penn State University, and Life Unites Us, and DDAP, as well as Shatterproof and Public Good Projects for having us here today. We are just so excited to be here to talk about older adults and substance use disorder services and behavioral health services. And we think this is such an important topic, and we're just so grateful to be able to participate today. And you can consider me the sort of, you know, when you go to the movies and you have the preview of coming attractions, my colleague Lynn is the big attraction today. And I know she's probably shaking her head right now. I'm going to sort of warm things up for Lynn by giving you a little bit of background on the Department of Aging's work and the population and why this is so important. And then she's going to kind of get into the nuts and bolts of things. So if Erica, if you can go to the next slide. Let's talk a little bit about the aging population. And the reason why I want to share this with you is that this sort of gives you a little bit of background as to why we really need to be focused on this. So I don't think it's any secret that the United States population is aging. So in the country nationally, more than 46 million people are 65 and older in the US. And between 2020 and 2030 alone, when the last baby boomer cohorts reach 65, which will be in 2029, the number of older adults is projected to increase by almost 18 million people. So that's a 39% increase. By 2030, 1 in 5 people in this country is projected to be 65 and older. And the dependency ratio shift is to be that older adults will outnumber children, people under 18 for the first time in US history. So this is a pretty big deal, but even more for those of you here today on the call, it's an even bigger deal in Pennsylvania because Pennsylvania has an aging population. So let's talk a little bit about that if we can go to the next slide. We have an aging state. I'll just share, before I share the contents of the slide, you see our population shared in different ways. So our population, we talk at the Department of Aging and our area agencies on aging and the Association of Area Agencies on Aging, we make reference to older adults as people over 60. I don't like to hear that because I'm in my 50s and that makes me feel like I'm getting old, but that's okay. Being older is good. Anyway, back to that. We talk about being over 60 as being an older adult because the Older Americans Act, which is a law that guides some of our work, considers people over 60 in the programs inside that act. So I'm going to make reference in this slide to people over 60. So in Pennsylvania, we have about 13 million people here in our state. And I know when people were entering their information into the chat, there's folks on this webinar from all over Pennsylvania. So right now, over 3.4 million people 1 in 4 Pennsylvanians is over 60. That's a lot. So getting a little crowd of people, 1 in 4 people is probably over 60. And by 2030, that's not too far from now, that number is expected to reach 4 million people. And that's going to account for 1 in 3 Pennsylvanians. So that's a lot. And, you know, it's interesting. I know Erica mentioned that I do some work with universities and college students, and a lot of times the college students are not expecting to do work with older adults. But as you know, many of you are providers. Recovery centers and hospitals and rehab units are not filled with children. They're filled with mostly older people. And then another just small fact that I wanted to share, in Pennsylvania, the suicide rate, which we all know that suicide can be tied to behavioral health and substance use disorder issues. The suicide rate in older adult males 65 and older is 30.2 per 100,000 compared to the national average of 31.5. But comparing that to all populations in Pennsylvania, the suicide rate is 13.1. So if you were unaware of that, older adult males have one of the highest suicide rates of all populations. So it is a population that is overlooked, and this kind of gives you a little bit of a backdrop to what we're dealing with. So in the next couple of slides, I'll tell you a little bit about how we're organized. Pennsylvania has a Department of Aging as part of state government, and we have it's considered a state unit on aging federally. So every state has a state unit on aging, and we oversee all of the Older Americans Act. That's the act I just referred to, programs and services, lottery funded programs and services. So Pennsylvania is the only state in the country to dedicate all of its lottery programs to programs, all of its lottery funds that it receives to programs that benefit older adults. And then our federal partners, as many of you know, you have federal partners that help fund you. Our federal partners are at HHS, at the Administration for Community Living. The way that we get our work done is through a network of 52 wonderful area agencies on aging across the 67 counties. So there's 52 agencies, some serve more than one county. I know single county authority folks out there, I know I saw a couple of you on the webinar today. You may have contact with your area agency on aging, and I hope you do. And today we're going to talk about how we make that happen. Our social services professionals at area agencies on aging, the work that they do is they assess the needs of older adults who are 60 years old and older and develop service plans that can include care and services. And those services, we want to make it possible for older adults to age in place in their homes and communities, because generally that's where people want to be. Next slide. Another way that we get our work done, and we could not do it without them, is through established partnerships. There's complex problems. Behavioral health and addiction, as you all know, are complex problems. And one of those strategic partners is the Pennsylvania Association of Area Agencies on Aging. My colleague here today with me, Lynn Cooper, she is a strategic partner at the Association of Area Agencies on Aging, and we rely on their support to help us work with our area agencies on aging to address some of these strategic initiatives and work to ensure that we can provide outreach and maximize our support within the community on not only substance use disorder, behavioral health concerns, but a variety of issues that impact older adults. And with that, I'd like to turn it over to Lynn, and she's going to kind of dive in and talk more about some of the work that we're doing together.
Awesome. Thank you very much. Thank you, Stephanie. And you can hear me okay? Just want to make sure. I am so grateful for this opportunity to be here. And I want you to know, one, Stephanie was so kind to speak so highly of me, but we are so fortunate to have someone like Stephanie Cole at the Pennsylvania Department of Aging. And she is our project officer for a grant that we recently received, which we're going to talk a little bit more about in a few minutes. So thank you, Stephanie. Thank you, Erica, again, for the opportunity. P4A, I'll refer to it a couple times, I'm sure, in this presentation. We are basically a nonprofit association, and our job is to represent the needs of the area agencies on aging. We do a lot of work in policy and legislation on behalf of our members. The members of the state association have long recognized the need for improved access for mental health and substance use disorder services, and they have seen it in pretty much every level of care, from protective services, which is the thing we see most often, even in home delivery meals. There's lots of times where we run into these issues and realize how much our older adults need the services. And the next slide, please. What we did about 2 years ago, our board of directors made a conscious decision that while the knowledge of the need was not new, the decision was, with the support of the Pennsylvania Department of Aging, that we would make this a top priority. And especially given what Stephanie just shared about the numbers and the fact that the numbers are growing dramatically, that 40% increase in the number of people over the age of 65, you also know that's going to be a 40% increase in problems and issues and concerns. And our area agencies on aging are seeing it more than ever before. One of the first things that we have been working very hard in the last 2 years to communicate is that depression and anxiety is not a normal part of aging. It wasn't long ago, I was actually in the hospital for some surgery and heard my surgeon go next door to the room next to me. And I actually heard her say, or the older woman said, you know, I'm in so much pain. And the doctor said, oh, of course you're in pain. You're 85 years old. And then the next words were, and I'm so depressed. And unfortunately, my surgeon responded with, of course you're depressed, you're 85 years old. That's the kind of thing, and obviously I had a wonderful conversation with my surgeon soon after that encounter, but that's the kind of thing that we're working very hard to change. And access, for instance, to services is extremely limited for older adults, not for everyone, but for many older adults. And the reasons it's limited is varied. We're not pointing a finger at one system or one entity, but it's all over the board. The stigma, denial, and shame, lack of information, knowledge, definitely the whole issue of finances, so many regulatory barriers, especially as it relates to Medicare, and not to mention the staffing shortages and waiting lists that so many folks I know on this call are probably experiencing. Next slide, please. And this is where the consequences come in. And let me just back up for 1 second and say an aside that I know there are some friends of mine that are on this webinar right now, and I just want to say it's wonderful to have you here, and just apologize up front because you've probably heard me share this presentation a couple of times. But here's what we we want to talk about. No doubt, if a person does not have access to mental health and or addiction treatment, drug and alcohol services, it definitely jeopardizes their independent living and creates all kinds of other problems in terms of their health, the risk of suicide, healthcare costs. Just to give you a simple example, and this is really the reason that I'm here today talking to you, is because when I left my previous position, I worked for the Rehabilitation and Community Providers Association, previously Providers Association of Pennsylvania, and what we did and is work 26 years. I worked on regulatory issues, and when I left that job, I realized that after having gone through what I did with my mother, that this was my new calling in life, frankly, and that this is where I wanted to put my energy. But my mom, about 6 years after my father passed away, my mom became addicted to opioids. This was back in the really height of the opioid addiction in 2011. And she had injured her back and started taking pain medication. And it was amazing to me once, and full disclosure, I'm in recovery and have been for 33 years myself. So I saw what was happening, but what made it worse is that my family and her doctor at that time, this was before the docs got all the push to better understand the impact that these prescriptions were having on folks. And but there was so much misunderstanding, but my family would say things like, "Lynn, we know you're all about your recovery stuff, but mom's in pain. She's 85 years old. Let her take whatever she wants." And my response to that was, Mom is in jeopardy. She kept falling. She would misuse the medication. As I said, she got terribly addicted. She would fall, end up in the emergency department, all kinds of rehab costs. It was astounding. And that's why I'm here. Next slide. But this is the potential upside, and we can definitely work hard to, once we are able to help connect older adults, I believe at the core of my soul, and I'm an example of it, treatment works and treatment saves lives every day. And I knew that if we could get my mom the help she needed, some of these other much improved things would unfold for her. Next slide. And this is where the interprofessional collaboration comes in. And I was hired primarily to work with other state associations and county associations across the Commonwealth to take a look at what the barriers might be for older adults to access services, and then do whatever we could to help in our way to improve those barriers and to look for potential solutions. One of the things we noticed immediately were some of the problems in the funding systems, and especially Medicare. And early on, for instance, folks at the National Mental Health Association actually sort of laughed when I said that's going to be our goal, is to make some changes in Medicare. But we are, and we've already made some, not P4A, of course, but the entire community by Medicare now allowing for licensed marriage and family therapists and mental health counselors. You know, we have to have more providers that provide Medicare, because many of our older adults have Medicare only. Lots of training is needed on both sides. We've been working hard to train our AAA staff on depression and anxiety and substance use disorder and help them understand the limitations, the access issues. And on the other side, we've been working very hard. I'm so fortunate to be able to be a part of the Older Adult Committee of the Mental Health Planning Council. And that group is working very hard with OMSAWS to do more to help mental health and substance use disorder providers across the Commonwealth get what they need to serve older adults. Many are already serving older adults, no question about it. But some of the problems are that we need new options and new types of services to reach older adults. To have an older adult that is 80 years old and suffering from depression to come to a group at a mental health clinic or facility and sit in a group with 40 and 50-year-olds, it's a different world. And most of our older adults, we need to talk about meeting them where they are. Next slide, please. And this is really key. A lot of our older adults are at home. No doubt they're at home. They're in skilled nursing facilities. They're at AAAs and senior centers. We've been having conversations with mental health providers and managed care companies all over the Commonwealth to look at the possibility of coming into senior centers and actually doing, for instance, we could have a group on depression for older adults or grief or, and lots of talk about more telehealth, doing a lot more telehealth services and in-home services, mobile care for older adults. We have lots of older adults that do not want and are very hesitant to get up and go to a mental health clinic, but they would welcome someone coming to their home. And I know all of that is incredibly difficult right now, given the staffing shortages that exist and frankly, the lack of funding. There's just not enough funding. And that's one of the things that we are spending a great deal of time and energy on, working with the legislature and others to emphasize the need for more money in the mental health system and to allow some of those dollars to be focused on the needs of older adults. Crisis regulations are huge. Again, it's another area where our area agencies on aging have struggled sometimes because there's such a lack of understanding about what's happening in that crisis for the older adult. And sometimes assumptions are made that it's dementia, not mental illness. And we've been working with Dr. Adair and Matthew Winterstein and lots of others across the crisis continuum to talk about what might be best in a crisis situation with an older adult. And we definitely, the area agencies on aging, we are there to help. We want to help, but we don't do crisis. That's one thing we don't do. And it's a misunderstanding. When you hear protective services, some folks think, well, they call the area agency on aging. They must be the ones to, and that's not the case. We don't do crisis. We don't do de-escalation. We don't do mental health, but we're happy to be there and help in any way we can. Next slide, please. This is a bulletin and it relates to crisis, but it relates to all services. And we are so grateful to the Office of Mental Health and Substance Abuse Services for issuing this. It was issued in August of 2022. And it's not new. It was issued in 2006, and it was simply reissued to clarify that a person experienced a neurocognitive disorder, such as dementia, can't be denied mental health assessment, and assumptions can't be made, and that mental health treatment works even if a person does have a diagnosis of dementia. And that's a big misunderstanding that we're working on right now to help the community understand and to help get the community what they need in order to make this happen. Next slide. And this is our grant, basically. This is our project that I'm so grateful that Stephanie Cole and the new secretary, Jason Kavulich of the Department of Aging, has been supportive of. We have 2 pilot programs. One of them is has a wonderful emphasis on the Latino community, and our job is to help identify older adults that would benefit from services and provide. We have a terrific program that the Department of Aging has initiated called Healthy Ideas, and that program is evidence-based, working on depression and self-management. And depression and anxiety are the #1 issues that older adults deal with. And we're also working hard in these initiatives to link our programs. It's just been tremendous. The program in Lehigh and Northampton has been up and running since March 20th of this year. And I can't even begin to tell you how much has been accomplished in such a short time. We have so many folks in those 2 counties that have immediately jumped on board with us. And there's not one person that we've contacted that has said something like, well, we don't know what you're talking about. We don't really think this is a big problem. Everybody has been right on board with us and has said, we've seen increases too. We need to work together. We want to know what we can all do to help older adults access services, especially before they end up in a crisis or end up in an emergency department. And I happen to notice that Jennifer Jordan from HAP is on this webinar. And thank you, Jennifer Jordan, for your leadership on this issue with the Hospital and Health System Association of Pennsylvania. Next slide. I basically have already talked about this, but there are a couple things. Building linkages, we already talked about that. Working to connect older adults to services, building complex case teams in areas where they don't exist. In some areas, they already exist. And then we're also working on reducing stigma and biases. Next slide. We had a summit. It was excellent, June 5th and 6th. It was a day and a half, and we had over 100 stakeholders there. This is where we heard so much from those other stakeholders about the desire to work together to meet these needs. And we're in the process now of putting together a task force that's going to be representing those 2 counties. And we have a whole list of barriers that we identified at that summit, and we have a whole list of possible solutions, and that task force is going to be working together on those. Next slide. And this is a slide that Stephanie just did a phenomenal job on. I think she was actually at our summit also, and has a wonderful long history of working in the aging community. But one of the things we need to talk about is checking our own biases. And I have to tell you, I never saw myself as being ageist. Ever. And I'm 68. I mean, I'm in that category. I'm the older than 65. And I never thought of some of the things that I would say, like, for instance, one of the early papers that I wrote for the State Association, one of the white papers, I started it out with a silver tsunami is coming. And I never thought that that was in any way ageist or negative. I was mostly just trying to say that we're going to see huge increases. But when you think of a tsunami, you think of a whole community or an entire island or area being wiped out. And I learned from the training that I went through on ageism that we need to work on changing the way we communicate about older adults and even the way we feel about older adults. One of the things is thinking in terms of each older adult as an individual. And just like every kid is different and needs a person-centered approach, it's the same thing with older adults. or every person, frankly. But we want to talk to you about collaborating with your local area agency on aging if you aren't already, and what can we do to help encourage that collaboration. AAAs have advisory councils, and I know Stephanie wanted to extend a welcome invitation to you to consider participating on yours. We have local task forces that are being built all over the Commonwealth right now by our area agencies on aging. There's an excellent one in Lancaster County, for instance, right now that has managed care, hospitals, treatment providers, persons in recovery, mental health association. It's just incredible. And they're doing some great work building those connections and looking at those potential changes in the community to help broaden service access. Great. This is one of the most important things. If you don't remember anything else I said today, please remember the E4 Center. And those of you who have already been a part of any presentation I've ever given for more than 5 minutes knows that I can't end a presentation without talking about the E4 Center. The E4 Center is an organization that was funded by SAMHSA, Substance Abuse Mental Health Services Administration, and their sole purpose is to address the disparities that exist in behavioral health services for older adults. And there is a wealth of information. I have learned so much, and I continue to with every new course that they put out. They have some excellent, they have some community work group sort of manuals and great ideas for how to work together almost step by step in addressing these issues. They also have put together, they did a great job of putting together a 988 education at 6 modules for 988 operators, and we're hoping to see that expanded to crisis operators in Pennsylvania, other crisis operators. And it's 6 modules that address mental health in older adults, the whole issue of neurocognitive disorder and mental illness and how they relate. Excellent sources. Just want to ask you to please consider taking a look at that. And I think it's time for me to hand things back over to Stephanie.
Yes,
Yeah.
Thank you, Lynn. And as you were talking, I was making some notes and thought of some additional things to share, of course.
Good. Please do.
Yeah, and Erica, you may even want to leave or allow Lynn's video to stay up there because I may bounce back to her for a couple things. But before I talk about the resources that I shared, just thinking through some of the things that Lynn provided, and things that, in all of you as participants, your line of work may not be aware of. So as I mentioned earlier in the presentation, our area agencies on aging, they go out to a client's home. So generally, here's how things work. Our area agencies on aging will get a phone call. Basically, somebody needs help, and sometimes it'll start with nutrition, or the house is getting cluttered and maybe needs cleaned up. And the care manager will go out and do an assessment of the needs of what's going on in the home, and what's going on with the older adult, and it's with that person face to face. And at any given time in our system of data collection, we've seen and spoken to and are actively managing, either in from very basic things like senior centers and transportation services, all the way up to care managed services like personal care in the home. About 530,000 to 550,000 people at any point in time. So I already told you there's 3.4 million people in Pennsylvania that are over 60. So only 550,000 are being served by what we provide. But the point that I wanted to make to you is that we collect a lot of information from the people that we see. Part of that information includes information on, and it's a self-attestation. So, take this for what it is, but I will tell you that over half the people that are assessed for services say that they're being treated for anxiety, depression, or both. Over half. So I wanted to share that is out there. And a couple thoughts that I wanted to share, since I know that all of you encounter older adults in your day-to-day. Some of the things that we see, older adults this is a unique, I think for many older adults, not all, but many older adults are of the mind that they're very respectful of their doctors. And if a doctor, and Lynn, you can please chime in, if a doctor prescribes something, they're going to take it because they respect what their doctor says. And if they leave, their bypass surgery with a laundry list of medications, they go to CVS or Rite Aid or whatever and pick it up and they take it. They're not as likely to question all of the scripts that they're given. So how can we help? We can help by helping older adults be good advocates by asking questions to their doctor about the medications that they're being given and why. Many times, for example, open heart surgery is followed up by a prescription for antidepressants. That's just part of the protocol. And some people do need them. So small example, but just advocating, helping older adults learn to advocate for themselves with their doctors.
Well, and
then
just to
go
add,
ahead, please.
Just to add, Stephanie, before you move off of that, I mean, that's one of the things that my mom really struggled with. She kept trying different antidepressants, and then she became disillusioned in terms of, because she really wasn't given a complete mental health assessment and mental health services. And those who work in this field that are on this call, that the thing that's most effective is when you can provide medication and cognitive behavioral therapy or other therapies, whether it's art therapy, group therapy, other types of, that is what is most effective. And so often, even though somebody has been able to access an antidepressant, it's not enough. It's just not enough.
Yeah. Thank you, Lynn. And also wanted to share on the substance use disorder side of things. We, as I mentioned, we end up visiting older adults because either they call for a referral or a concerned family member calls and makes a referral. And that visit, usually includes an environmental scan of the person's living situation. And I think we all know how important nutrition is throughout life, but it becomes so much more critically important as we age. Building those habits early is important, but for older adults, having the right balance of nutrition is so important. And if an older adult is using, say, for example, alcohol, many times that will be the nutrition that they get. And there are instances where, there's a somewhat empty fridge, but there's, alcohol around. And so that's where the calories are coming from. And so these are the types of situations where they're capacity reducing, and the person, it may be isolated and lonely. And so there's just a mix of different things going on. I don't know, Lynn, if you wanted to reflect on that at all.
I think what you've said is absolutely perfect, Stephanie.
Okay.
It
Okay.
is. It's a mix.
Yeah. And then let's see here. The other thing I wanted to share or ask before we get into any questions that are put into the chat and before I share my resources is, Lynn, I know there's going to be people that say, I want to get involved in this work that you're doing, out there with the AAAs. We're doing some on the west side of the state, some in Lehigh and Northampton counties, but we're still trying to implement things throughout the Commonwealth. So is there a way that people can get involved and try and network into what, we have going on?
Absolutely. And thank you for mentioning that. Couple of things. The first thing I think you should do is contact your area agency on aging. Now, I want to let you know right off the bat, there's not one area agency on aging in the Commonwealth that isn't aware of these issues, but not everyone on that staff may have, we've been working very hard for a couple of years, but there's a lot more work to do. And in fact, getting this information to all of our area agencies on aging. But I encourage you to speak to the executive director of that agency. And if you run into any trouble or any hesitation or that person's not available to you, please don't hesitate to give me a call. You'll see my contact information at the end of this. I know there are 64 people on this call right now. And if you're from a county that we don't have an active task force, I'd love to talk to you about maybe starting one. And it doesn't matter where you're from. If you're from the single county authority, and I noticed that one person put in the comments that you're seeing more problems with older adults in the drug and alcohol area and some issues with housing. And let's get together. Let's talk about, what we can do. But contact your area agency on aging. Give me a call at any time. We would love to start our discussions. We're doing it all over the state. And it's likely there's a task force in your area that's being organized.
Thank you, Lynn. And so let me talk a little bit about these resources that are on this slide. First, and I know the slide deck is going to be recorded or shared with those of you who are on and who registered. So first, there's a link to an area agency on aging locator map. So you can click on the county and find the local area agencies on aging. They're easy to find on the internet, but sometimes kind of can be maybe not sure because they're some are private nonprofit organizations, some are under the umbrella of a larger organization, some are county organizations. So this is an easy place to go and find exactly what you're looking for. Then this PA link to aging and disabilities resources, if you're ever working with a client and they're looking for long-term services and supports that are available to them, even if they're an adult living with disabilities and they're over 18, this is a good place to just start them. Just they can kind of look, see what's there. There's a phone line. That phone line, they may refer them to the AAA. They may refer them somewhere else. But it's definitely a good resource as well. Also, we're very proud in Pennsylvania that we have nearly 500 senior community centers, which right there is a great prevention activity in and of itself. They have all sorts of activities. Not only that, they serve congregate meals, which are nutritionally balanced and help ensure that older adults are getting what they need, physically. So some of those other issues may not become an issue. And there's a link there to find all the senior centers in your local area so you can refer folks to those. I know Lynn mentioned this, it's a Healthy Ideas program. IDEAS stands for Identifying Depression and Empowering Activities for Seniors. We have some areas that are have that program as a regular program within their service area. Would love to see you even inquire about it if an agency doesn't have it yet. It's good because if you're asking for it, it means we'll try to get it going in more areas. We have all sorts of other health and wellness programs, including chronic disease self-management. And of course, those become more prevalent for older adults, like diabetes and high blood pressure, things like that. And then we have our flagship program is our pharmaceutical assistance program. It's PACE, it's called PACE. PACE means something else in other states, but in Pennsylvania, it's the Pharmaceutical Assistance Contract for the Elderly. And if you have clients that are 65 or older who are having trouble paying for their prescriptions, or, you know, you suspect they are, sometimes people are, you know, embarrassed. They don't want to tell you that that's an issue. They'll try to, like, you know, I'm only going to take half my prescription and I'll make it last for 2 months. We can, if they meet income qualifications, or even if they don't, we can usually find a way to help them. So go into that link and, you know, call the phone number, and those folks are phenomenal and they can try and help. But always, if you're not sure where to start, always start with your local AAA. They know the community better than anyone else, and they will be happy to work with you. And our last slide, I think, has our contact information on it, Erica. And
Yes, thank you both so much
yeah.
for sharing all of that information. As was mentioned, all these slides will be shared on the Life Days' data dashboard, so anybody can contact Lynn or Stephanie if they specifically have questions that they would like to ask after we wrap up for today. But without further ado, we will jump right into questions here. Looks like we have a couple. All right. So we have a question in the Q&A from Amy. One of the biggest barriers I found are programs and treatment services that can't accommodate those with physical limitations. I ran into several incidents where our folks with the most critical needs are turned away from various 3.7 to 4.0 treatment facilities for substance use because they don't have the staff. Facilities are not wheelchair accessible, you know, can't appropriately dispense medications. Also, some rehab facilities have older adult floors, but rarely is their programming tailored to older adults. Do you have any thoughts on addressing those barriers, or things that they could do, or resources that they could access to help address some of these?
Absolutely. I'll take a stab at it first, and Stephanie, hand it over to you. But one of the things that what you've just described, what the person that asked that question just described, is basically at the heart of what we're trying to get at when we talk about capacity building. And we're, in fact, there's a wonderful example of that. Joe DeMeo, I hope he's still on this call, but he was on earlier. Joe DeMeo works for Community Behavioral Health in Philadelphia and has actually been working to build out some specialty providers, behavioral health providers within, for instance, a skilled nursing facility. And what has been described is what we have a lot of trouble with. One, sometimes our older adult has some physical disabilities that the treatment provider isn't able to help with. They may have some health issues that aren't able to be addressed. And that is one of the things. In fact, we're asking the Office of Mental Health and Substance Abuse Services to do a statewide survey of all counties, single county authorities, and mental health administrators to try to get a better assessment of what's out there and what the providers might need to be able to improve access. But right now, today, it is very difficult to find a provider that can meet all the needs. And I work on a case-by-case basis. If anyone is having a problem, please don't hesitate to give me a call. I will tell you the managed care companies have been fantastic. They have been working very hard on complex case teams with us, with our area agencies on aging, to find a perfect placement for, well, nothing's perfect, but for a placement for an older adult. So don't give up. And please, if I can help in any way, give me a call, and the Area Agency on Aging may be able to help you also. Stephanie, did you want to add any?
I was just going to say that yes, thank you. And we need to hear about those situations so that we can advocate at the state level. So yeah, I think everything you shared was great too, Lynn.
All right, great. Next question, I'm not going to read all of it, but person in here, social worker, and also has a family member who's an older adult. And it seems like they're having trouble with their loved one declining services, and various professionals kind of giving different opinions about kind of their needs. So, you know, based on some of these challenges, do you have any resources like any advocacy resources or suggestions for folks that are struggling to navigate the system to help their loved ones get the help they need, but the loved ones are not necessarily as receptive, or they're having challenges with case providers?
My suggestion would be talking to a person-centered counselor. So I think we put up the information on the last slide about the link to aging and disability resources. And the person-centered counseling assessment, I feel like everything that we do is supposed to be person-centered, but I feel like that one really helps try to understand what would suit the person the best and get at the heart of what they're looking for. That is not a unique challenge. I think it's really important that as a caregiver, people know that they're not alone, you know, and if a person has capacity, that becomes a really tricky issue, especially even for our social workers, because people have the right to make decisions that we maybe even don't like. And so it's a tough situation, I know. I don't know, Lynn, if you have anything to add to that.
Well, it's been interesting. First of all, my heart hurts for the person that and I read that question at one point earlier. I can relate so much. I mean, it was really difficult for me to, and I have to be honest with you, I really wasn't ever able to get my mom the kind of help and treatment that she needed. And I hate to say that because it sounds so negative. But don't give up. I mean, that's the first thing. And keep reaching out. I have a brother right now who's 71 years old, who is diagnosed with mental illness, dementia, and is a brain injury survivor. And I have to tell you, he's in North Carolina, so it's made it more difficult. I've just never given up. I keep making call after call after call. And I have to tell you, I've met this amazing ombudsman named Angela, who is already, you know, taking the bull by the horns, so to speak, and helping my brother access the services he needs. And again, if there's anything I can do, please don't hesitate to give me a call. The managed care companies have been great, insurance, mental health administrators, single county authorities. It's one phone call to them. There's a lot of people out there that want to help.
Great, thank you both. I know we're almost at time here, but there's one question left I want to see if we can get to quickly. This commenter said, we're seeing a larger number of clients, 65 and older, come in for drug and alcohol treatment, but finding safe housing options is really an issue, as many are homeless or their family will not allow them back into their home until they're seeing that they're not returning to their previous use. Do you know of any housing resources that they could reference?
Well, one thing that I will add, first of all, is that at our summit, it was amazing that at our summit that we held in Lehigh and Northampton counties, housing was a huge issue. I mean, it was amazing how much time and energy we had to spend on that, and how much work needs to be done to make more housing available. And I have to tell you, I don't have a perfect answer for you. But again, I would say work with your area agency on aging. You know, the Pennsylvania link that Stephanie called about, my guess is they're going to have information about housing available. And it's every entity, even the mental health administrators, single county authorities, everybody is working very hard on housing. And I just encourage you not to give up. Stephanie, what am I missing?
I think you hit it all. We are aware that that's a problem, and I know that a lot is being done to try and ensure that the housing stock is increased. But I know that doesn't help an immediate need. If there's a emergent need, I would definitely call your area agency on aging and see if they know of any resources.
Great, thank you both. We are going to wrap up since we're over time here. I want to give a big thank you to our presenters. You shared so much useful information and just really appreciate the time and energy you put into this presentation for our Life Unites Us webinar here in July. And I want to thank everybody for joining us today. I do just want to mention that when you close out of this meeting, you'll be directed to a survey. If you could just take a few quick minutes to let us know how the presentation went and your thoughts about it, we would really appreciate it. We use that to help guide future webinars. And as I mentioned, a recording and a link to the slides and Stephanie and Lynn's contact information will be available there. If you have any questions, feel free to reach out, and I hope everybody has a great rest of their day. Thanks, everybody.